Hi, I am Andrea Wong-Sam, a proud volunteer for and supporter of the American Heart Association. As a heart attack survivor myself, I am so excited to sit down with you to talk about the critical importance of women's cardiovascular health. The Red Chair Series conversations seek to inspire and inform women to be strong advocates for their health and well-being. I am thrilled to talk to Dr. Lili Barouch, a cardiologist with Johns Hopkins Medicine. Dr. Barouch, can you tell us about yourself and your practice?
Sure, and it's great to be here today. I'm the Director of Sports Cardiology at Johns Hopkins, and I'm also a part of the Women's Cardiovascular Health Center. I see a wide variety of outpatients, both men and women who are physically active. They don't have to be elite athletes, but anyone who's active, considers himself an athlete, or who just likes to exercise.
What are some specific cardiac considerations for females versus male athletes?
So there are a lot of differences, and there are a lot of similarities as well. The first thing to remember is women are not just small men. There are some different considerations in how the heart remodels with exercise. Just like any other muscle, your heart gets more efficient and stronger with more exercise. But women's hearts remodel a little bit differently from men's.
Dr. Barouch, when you say remodeling, what does that mean?
So as someone exercises more, then the heart tends to get a little bit larger and the muscle gets a little bit thicker. And that happens to a greater extent in male athletes versus female athletes, but it happens in both.
What exercise recommendations do you have for women at different stages of their lives?
So the American Heart Association general recommendations for exercise are for 150 minutes per week, that's 2.5 hours total, of moderate intensity exercise, and about half of that for vigorous exercise. Vigorous exercise, running, high intensity cycling. Moderate would be things like brisk walking. For women that are perimenopausal and postmenopausal, it's also important to incorporate some strength training, 30 minutes twice per week. There's some differences between how women and men respond to exercise. So more is better up to a point. So those are the minimum recommendations. Up to about 2 or 3 times that, you can get additional cardiac benefit with improvements in blood pressure and cholesterol and reduced risk.
So as a heart attack survivor, do you have recommendations for women after a heart attack or after a heart event?
Yes, absolutely. So exercise is a very important part of recovery, but you have to do it carefully. So after a heart attack, there is a period of recovery, and then most people who survive a heart attack would be recommended to go to a cardiac rehab program, which is a gradually increasing exercise program to help in recovery. So that program is usually 3 months long. Most heart attack survivors, if they have a good recovery with good heart function afterwards, should be able to return to a full amount of exercise without restrictions eventually. Once you've recovered, after 6 to 12 months after the event, you should be able to be back to your full amount of activity.
So as a follow-up question, how about exercise as it relates to weight loss?
So that's an important consideration. A lot of people who are overweight have been told by their doctors to lose weight or that it might be healthier, things like that. I really try to emphasize to my patients that a healthy diet and healthy amounts of exercise are the most important thing. I'll often say it's more important to be fit than to be thin. There are also some cultures in which some more traditional cultures in which women are discouraged from exercising, or whether it might be considered inappropriate to go to a gym, things like that. And for people who are in that situation, I'll often recommend that they walk with a friend or something that might be less formal exercise per se, but still get them moving. Women tend to get different symptoms from men when they have heart problems, so they don't always get the classic chest pain in the center going down the left arm. Sometimes women may only just feel nauseous or feel unwell when they're exercising, things like that. So it's really important to listen to your body. If you have a symptom that you think might be cardiac, or even if you're not sure what it is, but it doesn't feel right, you should check in with your doctor and see if you need an evaluation.
The Red Chair Series conversations seek to inspire and inform women to be strong advocates for their heart health and their well-being. Thank you so much for sharing everything with us today, Dr. Barouch. The American Heart Association has many tools and resources online at www.goredforwomen.org. And thank you to Johns Hopkins Medicine for supporting this Red Chair series.